Yeah, I give Japanese investigators a lot of credit because they really do these trials to define standards of care. And I'm always impressed that they're very reluctant to introduce treatments that can be more harmful to patients. And this was really a pivotal trial because there are a lot of retrospective analyses that suggest that patients with stage 4 metastatic colon cancer that have had the primary resected, even in the setting of metastatic disease, do better. Now those kind of retrospective analyses are really fraught with patient selection because obviously patients that go to surgery have better performance status, a lower tumor burden. There are a lot of biasing factors. But this has almost become incorporated into many oncologists' thinking that patients that get the primary tumor out do better. So the Japanese did a randomized trial. They took untreated stage 4 metastatic colorectal cancer patients and they randomized patients to get just chemotherapy alone, typically fluorinated pyrimidine, oxaliplatin, and bevacizumab, or surgery first on the primary followed by chemotherapy. And they didn't accrue all the patients that were planned. They ultimately accrued under 200 patients. They were looking to get 600 or 700 patients, but the trial accrued very slowly. But even with the lower rate of accrual, this was a negative trial. In fact, there was no difference in survival. The survival curves were completely superimposable, no difference in progression-free survival. There were more deaths on patients that underwent palliative primary surgery. There were 3 or 4 deaths postoperatively from operative complications. And the group of patients that had surgery up front had more chemotherapy toxicity. So not only did it have no improvement in progression-free and overall survival, it actually was detrimental. And I think this is a practice-changing trial because so many investigators have quoted this retrospective data saying patients do better when they get the primary taken out. Now we have level 1 evidence that this is not the case. And the other important message, of the patients that got chemotherapy alone, only 5% went on to ultimately get surgery on the primary. So even if you waited, a tiny minority of patients required surgery in the future because chemotherapy is effective. So that's a practice-changing trial. Patients with stage 4 colon cancer, unless the tumor is bleeding or obstructed, they should not undergo surgery. They should get chemotherapy.